My role here at U of M is to teach students and to offer thoughts about the legal institutions that surround and create our healthcare system. I served at the Department of Justice prior to joining the law school faculty. And while there, I defended the federal government in lots of healthcare-related disputes. The federal government is deeply involved in healthcare along a myriad of different dimensions. The switch from the practice of law to the teaching of law and to the study of law was prompted by my desire to get my hands deeper into some of the issues that I'm most passionate about. When I went to law school, the things that I was most interested in were the big structural questions about how we make sure people have adequate education, adequate shelter, adequate healthcare. And those interests led me into questions about administrative law, which is a study of how the federal government and the state governments accomplish what it is they want to do. And that study led me even more deeply into questions surrounding healthcare. Part of my interest was prompted by the enactment of the Affordable Care Act, which has spurred a number of changes in the governing legal regime and has kicked up a ton of interesting questions. Questions about what it is the federal government can and can't do in attempting to roll out its measures and extend near universal insurance coverage. Other parts of my research focus on questions about Medicare structure, for example, or looks at the way we regulate the private healthcare system and asks, do we have the right set of tools to make sure that people have access to high-quality, low-cost healthcare? To me, the most significant and urgent question surrounding healthcare today is how to make sure we get good value. Right now, we pay an extraordinary amount of money for healthcare in this country, much of which is very high quality, but a lot of which is appallingly low quality. So we want to do better on the quality side, better quality healthcare, and also better on the price side, making sure that what we get good value for. The Institute for Healthcare Policy and Innovation was an opportunity for me to try talking to those who are delivering care on the front lines, or to the economists who are looking at the actual data about how healthcare is interacting with individuals on the ground. It's a place where people can bounce ideas off of one another. They can rub shoulders in the hallways and have an unprompted conversation about whatever happens to be in the forefront of their minds. One of the major virtues of being associated with the Institute is that we can have our ideas heard in the public sphere. When I first became associated with the Institute, John Ainian, the head of the Institute, reached out to me and said, you should think about having your ideas heard in medical journals. There are a lot of physicians out there who might be curious, who might be interested, and the thought hadn't even occurred to me. Stuff that I've written has shown up in dozens of newspaper reports. It's shown up in the New England Journal of Medicine. It's showed up in district court opinions, all trying to figure out questions surrounding the implementation of the Affordable Care Act or healthcare law more generally. And it's exciting to have that kind of real-world connection. The only way you're going to get the kind of ideas that you need to reform the healthcare system is if people talk with each other. Physicians talk with policymakers, talk with members of Congress, talk with economists, and whether we shape the policy debates or we change best practices, either way we're having an effect on the ground. We're not just sitting in our offices thinking up ideas that never see the light of day. We're actually interacting with the world at large.